I'm Christy. I used to smoke cigarettes. I had smoker's cough and severe shortness of breath, and I knew I had to quit. Then I tried e-cigarettes, but I just ended up using both. I really didn't start to get better until I quit smoking completely. My tip to you is, just cutting down on the number of cigarettes you smoke isn't enough.
Smoking even a few cigarettes a day is dangerous. You can quit. For free help, call 1-800-QUIT-NOW. A message from the Centers for Disease Control and Prevention.
This is Brittany Huffman, Program Coordinator of Tobacco Free Allegheny, reminding you that November 15th through the 21st is Allegheny Quits for Life Cessation Awareness Week. Help to quit smoking is all around, including the PA Free Quit line. Call them today at 1-800-QUIT-NOW.
Hello, and welcome to Healthy Living with Tobacco Free Allegheny. I'm Joyce Petro. Today's cigarettes are even more addictive than those of the past due to design changes that have increased the efficiency of nicotine delivery and the amount of nicotine in tobacco products. Additives that are found both in traditional cigarettes and now in alternative products like e-cigarettes facilitate nicotine delivery, and that increases the appeal of the products, may increase and worsen the health consequences, and increases the risk of nicotine addiction. Certain populations, such as young people and those with psychiatric symptoms or mental illness, and those with chronic conditions, are more vulnerable to nicotine addiction and to the health consequences associated with nicotine use. Joining us today from Pittsburgh Mercy Health System are Stephanie Murtaugh, Senior Director of Mercy Community Health, and Mark Rogalsky, Unit Manager of Prevention Services at Mercy Community Health. With funding and support from Tobacco Free Allegheny, they conduct prevention programs for youth and specialized cessation programs for individuals with mental illness, substance use, and other chronic conditions. Welcome, Stephanie and Mark, and thank you for joining us today.
Thank you for having us.
Thank you.
Mark, we know that the best way to stop smoking is to never start. What programs can help young people stay smoke-free?
One of the things that we do is we do work with young people in the schools. We utilize a evidence and research-based curriculum called life skills training. And in this, it engages the students to work on their decision-making and problem-solving skills, so that if someone comes up to them and is trying to get them to use not only tobacco but drugs or alcohol, it helps them to be able to say no. We also utilize a number of different things that are out there on social media, positive things. CDC has videos that we're able to utilize that we can pull down and show them at the schools, as well as a number of different handouts. And there's also some really great programs like the Truth Initiative, where on TV and especially on ABC Family late at night, when they know that they have young people watching, different messages, short videos about how to deal with people that are smoking. There's one called Left Swiped At, where that if you see a picture on social media, you don't like it, you swipe to the left and you don't like it. We also utilize a very old video, believe it or not, from Fat Albert back in the day with Bill Cosby. And who would have thought 30 years ago that he would have done anything with second and third hand smoke? The video's entitled When Smoke Gets in Your Hair. And it's great with the younger kids, but we found that the older kids like it as well.
So we've heard about a program called Dancing Classrooms. Can you tell us about Dancing Classrooms and how it helps to prevent tobacco use?
Sure. Dancing Classrooms is a very different form of curriculum that we use. And it is a curriculum because there's a start and finish to it. We use that with young people. It's not about the dance. And everyone always thinks that the kids are just going to learn ballroom dance in 5th and 8th grade. But it's about so much more. It's about how they get along with each other. And it's also about being healthy. And they learn 5 different dances. And in those dances, it builds up. And they're very active. And they realize that if they can't function physically, they wouldn't be able to dance. Our instructors talk with them about things that they need to do, that they have to eat right, but also to stay away from things like smoking because of what that does to their lungs.
So, Stephanie, for those who are already smokers or tobacco users and that'd like to quit, what resources are available to help?
Well, today there's really many resources available. Throughout most communities, various classes are offered. One resource folks could look into is the Tobacco Free Allegheny website, where some of the classes would be listed. Also, a number of pharmacies are offering classes, and health plans. And I would encourage anybody to contact their health plan to find out if they have smoking free quit resources available, sometimes classes, sometimes online programs. Also, nicotine replacement therapy we find to be very helpful for folks to quit smoking, and many of the health plans now do cover those. And another really popular resource are apps. There are a number of really good apps available that you can download that can help you, track when you smoke, so you can plan what are the areas that you need to, times of day, or the areas that you need to target when you quit.
And the great thing about a lot of those apps is they're free. If you go to Google Store or to Apple and you pull those up, you can see the different ones. You can just go to Google and put in there, what can I do to quit smoking? The number of different things that you can do are just incredible.
So you have to find what works for you.
Exactly.
Could you talk about the Pennsylvania Free Quit Line? That's 1-800-QUIT-NOW. How does the quit line work?
So if you want to quit and you don't want to go and find a class, you're able to call 1-800-QUIT-NOW. They'll set you up with a counselor. You can get 2 weeks supply for free of nicotine replacement therapies. That could be the patch, it could be the gum, it could be the lozenge. They'll give you support. You can call in any time. And it's something that it's become very popular, I think, because a lot of times we'll hear from people that have said that I've called and they haven't been able to help me right now with the nicotine replacement therapies. So more and more people are using that. There's also Fax to Quit as well, that they operate as well, that people can call and make a referral via the Fax to Quit.
So nicotine replacement therapies do help people to quit smoking?
Absolutely. We found a lot of people that utilize, they may not like the gum, but they like the lozenges. They come in a variety of flavors, everything from cinnamon to mint to fruit flavors. And the face you just made, a lot of people felt that way about the fruit flavor. They like the cinnamon and the mint.
I didn't know they came in so many flavors.
Yeah, depending where you go. And they're depending where you go also to buy those, if you're going to pay for it out of your pocket, there's a variety of prices. One thing that we encourage people with the gum is the gum can actually be long-lasting. People have to use these once every hour for a good 30 to 40 minutes they're chewing the gum, but actually only 15 minutes at a time or less. They chew it and then they park it and then they chew it again. And they're actually able to take that out and wrap it up in plastic and save it because it's long acting, and instead of using a different piece of gum every so often, it makes it a lot easier.
Tobacco Free Allegheny, along with the Allegheny County Health Department and our community partners, are sponsoring Allegheny Quits for Life, a smoking cessation awareness week from November 15th through the 21st. Tell us a little about this week and what it's designed to do.
So a few months ago, folks from the County Health Department combined with those of us that work with Tobacco Free Allegheny, and we came up with the idea for Allegheny Quits for Life. Hashtag Allegheny Quits for Life. You put that into Twitter, into Google, and you'll be able to see a number of different things that are on the Live Well Allegheny website, as well as the County Health Department, Tobacco Free Allegheny, as well as Pittsburgh Mercy Health System, our social media outlets. So it's going to entail a week-long series of different events and communications that are designed to support people's efforts to quit smoking. Our partners are going to be critical in conveying this message throughout the county and helping it to become a healthier Allegheny, as Dr. Hackers started the plan for a healthy Allegheny. So November 15th through November 21st is Smoking Cessation Awareness Week. November 19th, the middle of the week, that Thursday, is the Great American Smokeout, day when people are encouraged to quit, even if it's just for one day. So there's a number of things that are going on. The first thing that's happening is Monday, November 16th, at the county courthouse, in their courtyard, we're having what we hope will be the first annual Merengue Monday. Merengue Monday's Dancing Classrooms is going to come out, and we're going to have a press conference with Dr. Hacker and a number of other folks talking about what the week is going to entail, and then we're going to teach everyone that's there how to do the merengue. So the merengue is actually the first dance that we teach kids when we do Dancing Classrooms. There's a lot of shaking, a lot of twirling, spinning around, a lot of stepping. You'll move a lot. And as Mr. Pierre Dulaine, the founder of the program, said, you got to shake what your mama gave you, and this is going to be a great time. And as we also like to say, the only thing smoking there that day will be the dance floor. We are really encouraging people to replace smoking all week long with healthy activities, and this is just one great example of it. Some other things that are going on throughout that week: Saturday, November 14th, the Bridge to Wellness Expo that's hosted by the American Diabetes Association at the David L. Lawrence Convention Center. As I said, Monday, November 16th, Merengue Monday. Tuesday, November 17th, LaRoche College is hosting a TED Talks on tobacco. It'll be a brown bag lunch and learn. Bring your lunch. You can see some videos and slideshow presentation on smoking and how it affects the body. And at the Cardello Building from 11 a.m. to 1 p.m., you're hosting a Tobacco-Free Allegheny Take the Cake Tuesday. You can come and celebrate all the birthdays that you can have when you quit smoking with a piece of cake. TFA staff are going to be there to talk with people about the resources and way to quit smoking. Thursday, November 19th, is the Great American Smokeout, hosted by the American Cancer Society. Things are going on all over the area. At Pittsburgh Mercy Health System, we're doing a number of different things. One of the greatest things that's happening is in all of our residential programs, people that are smoking, or consumers that are smoking, are encouraged to pledge hours, how many hours that they will not smoke that day. And in turn, they're going to replace that with a healthy activity. They're going to be getting tokens. They'll have drawings. And then the folks that aren't smokers, just so they don't feel left out, as long as they engage in healthy activities, they'll get something as well. So there's different things going on all over the county that day. Tobacco-Free Allegheny is actually going to be set up in the county building on Grand Street from 9 to 2. People want any types of information. And then Saturday, November 21st, there's a women's conference hosted by Representative Keith Rothfuss at CCAC North Campus. He's going to have a morning of panels and discussions on topics about work, home, and health. And if you go to Tobacco Free Allegheny's website, www.tobaccofreeallegheny.org, there's a link there for this that you can RSVP on.
And so all of these activities are to help people become aware of all of the resources that are available to help them to quit.
Absolutely.
Okay,
they're free.
And they're free. We'll be right back with Stephanie Murtaugh and Mark Rogalsky of Pittsburgh Mercy Health System.
I'm Marlene, and I'm lucky. I have macular degeneration. That's when the blood vessels in your eyes leak, and you can see blind spots in front of you. Eventually, you can go blind. Smokers are a lot more likely to get macular degeneration. And I smoked. I'm lucky because there's a treatment for it. Every month, I sit in a chair with my eyes held open by a retractor. Then the doctor takes the needle and injects medicine right into my eyes. The first time the needle went in, it sounded like an egg cracking. Every time I feel that needle in my eyeball, I wonder why I ever put that cigarette in my mouth. My tip is, smoking wasn't worth going through all this. And I'm the lucky one.
Smoking can cause macular degeneration. You can quit. For free help, call 1-800-QUIT-NOW. A message from the Centers for Disease Control and Prevention.
This is Brittany Huffman, Program Coordinator of Tobacco Free Allegheny, reminding you that November 19th is the Great American Smokeout, a day when smokers all across the country put down their cigarettes for just one day, and possibly for life. Quitting is hard, but with the right mix of support, advice, and possibly medicine, you can make this time successful. Getting help can double your chances of quitting for good. The Pennsylvania Free Quit Line has professionals ready to help. Call the Quit Line today at 1-800-QUIT-NOW.
My name is Amanda. I work with women who are trying to quit smoking, and I have some tips for you in case you're pregnant or thinking about having a baby. First thing is, keep trying to quit, or better yet, don't start smoking. It can cause premature birth, which can then increase the risk of your baby having developmental delays, problems with eyesight, breathing, and more. So don't give up. There are people like me who are here to support you, because I know what can happen if you don't quit. Your baby could be born 2 months early and weigh only 3 pounds. She could be in the NICU for almost a month, put in an incubator and fed through a feeding tube that goes through her nose down into her little stomach. I know that because I smoked while I was pregnant, and that's what happened to my little baby. I quit. You can too. For free help, call 1-800-QUIT-NOW.
A message from the U.S. Department of Health and Human Services and CDC.
This is Brittany Huffman, Program Coordinator of Tobacco Free Allegheny, reminding you that November 15th through the 21st is Allegheny Quits for Life Cessation Awareness Week. Help to quit smoking is all around, including the PA Free Quit Line. Call them today at 1-800-QUIT-NOW.
Hey, I'm Brandon. The disease I got from smoking led to me having both of my legs amputated. It's called Berger's disease. That's where your blood vessels can get blocked because of blood clots that can destroy your skin tissue and lead to infection, gangrene, or worse. In my case, it started on my left foot. Eventually, I had to have my leg surgically removed just below my knee. I was 19. A few years later, I had to have my right leg removed too. I was a double amputee at 23 years old. The reason that happened was because I smoked. So I have a tip in case that happens to you. Take showers instead of baths, and use a shower chair. You'll find bathtubs are a lot harder to get in and out of when you don't have legs. Some of you might think I'm just making all this up. I wish I were.
Smoking causes immediate damage to your body. You can quit. For free help, call 1-800-QUIT-NOW. A message from the U.S. Department of Health and Human Services and CDC.
Welcome back to Healthy Living with Tobacco Free Allegheny. We're here with Stephanie Murtaugh and Mark Rogalsky of Pittsburgh Mercy Health System. Stephanie, due to the targeted cessation and prevention programs in the recent years, there has been a decrease in smoking in the general population. Could you tell us about the adult populations that you serve and whether you're seeing success in reducing the smoking rates?
Yes, I can talk about that. We are seeing success in reducing the smoking rates, and I'd say our success rate is around 20%. Some things to keep in mind for our listeners to think about is many individuals try to quit more than once. In fact, an average amount of times that folks attempt to quit before they're fully successful is about 7 times. So a person should not feel discouraged if they're making a quit attempt and are not completely successful. Oftentimes we will see, particularly in heavy smokers, that they will cut back significantly and reduce their smoking before they quit completely.
So definitely a case of if you don't succeed,
try again, absolutely.
And I think along with that, something that's important to note is that at Pittsburgh Mercy Health System, we have 5 tobacco treatment specialists, and they work with a lot of our folks, whether it be in our health center, in our residential sites, in our outpatient sites, and we try to celebrate every little step that they take to try to empower them more and more that they can do this.
even if they're just moving from, not even thinking about quitting to at least considering quitting is a huge step forward.
What strategies have you used to help people with mental illness stop smoking?
The strategies we use are similar strategies that we would use with anybody in the population, in that, we do encourage people to make a quit attempt. We advise people to use nicotine replacement therapy, to consider it. As Mark detailed earlier, different things work more effectively for different people. So many of those types of things are the same. We do have asked people to track before they actually quit when they smoke the heaviest, and many smokers will tell you they'll go periods of time when they don't smoke during the day, and then they'll have heavier periods. So then you design a plan to target those areas to make a change, replacing unhealthy behaviors with healthy behaviors. I think the difference is with people that perhaps are suffering from mental illness or even other chronic conditions, it's a little bit more challenging. They may think, I have so many other things I have to contend with. Do I want to take this on as well? And unfortunately, other individuals in our society sometimes give them a message that, don't even bother. But it's just simply not true. They can be very successful. We have I believe, a 19% success rate with the people we serve that have more very challenging mental health conditions. Sometimes there's, again, as I said earlier, more attempts that they have to make. Or we will work for a very long time to slowly cut back, maybe for a year or longer for a heavy smoker, to just slowly cut back before they make that full quit attempt.
What are some of the barriers faced by individuals with chronic conditions when they try to stop smoking, whether that's a chronic health condition or whether it's a chronic mental condition?
I think some of what I had said is that's just sort of feeling overwhelmed. Can I take this all on? And really establishing that confidence that they can do this. And in fact, they find that this will positively impact their other conditions. Smoking actually causes stress. Individuals feel because when you smoke, if I smoke it will reduce stress, but in fact it causes stress. You're actually going through withdrawal constantly throughout the day. So once you get through some of those initial barriers, you're going to find your physical health and mental health to improve.
One of the, almost going back a little bit, you were asking before about strategies, and one thing that we've done with some of our consumers is we've replaced times when they would be smoking with different types of activities. A couple of my staff have done some really neat stuff in terms of getting their minds to think about something else. And one of those things was we created a program called Trail a Day that my one treatment specialist did, and she would find local trails that were flat and they could walk for a few miles, believe it or not, and not be overwhelmed physically. And they would go out for about 3 hours, and during that time, they wouldn't think about smoking at all. And then when they got back and done, she would have a discussion with them, debrief. Was it easy? Was it hard? What was easy about it? What was hard about it? Did you think about smoking? And the reply was no. And build upon that and really try to get them to find things that they can do when they're not smoking, instead of smoking. And another thing that has been going on throughout Pittsburgh Mercy Health System is we have someone that is beginning to do a lot of work with gardening with a lot of our consumers. And at one of our personal care homes, there's a gentleman that sat down and for 6 hours straight sat there gardening. And he may be the heaviest smoker. Didn't even think twice about it. He was so focused. So we really try to build on those types of things and try to come up with different things like that. We almost have a Weight Watchers mentality the way we do our cessation classes, that it's maintenance. We keep working with them. Don't give up. Keep trying. You can do it. And we're as supportive as we can be. February 1st, 2015, our agency went completely smoke-free. And in that, we also had a smoke-free work shift policy. So we heard stories from some staff talk with us about they didn't even miss it. One of our own staff in another part of community health was a pretty heavy smoker. She was actually able to cut back almost 80%. And this is someone that I've personally been trying to get to quit for the last 15 years. But she really has embraced it, and she works hard at it, and knock on wood, she hasn't slipped and completely gone back.
At Pittsburgh Mercy, we want to be a model of health for the people we serve, but also for the community.
So it sounds like in all of these strategies that support, whether it's through cessation classes or through the quit line or through other counseling, it sounds like support is very important along with nicotine replacement. Is that correct?
That is correct.
Absolutely. Our cessation staff are available. If people want to call, they will give out their cell numbers and say to them, give me a call, text me if you need to talk to somebody. And a lot of folks really value that. That makes the difference.
So what final message would you like to give to our listeners?
If you haven't started, don't. Years ago, we had a young lady that created a bookmark for us that said, be smart, don't start. But I think for those folks that are smokers, you can do it. It doesn't have to be all at one time. Take baby steps. Whatever you can do,
don't give up. And if you need any help, give us a call. We'll be happy to help you with linking with resources, or if we can help you, if you can attend one of our classes or whatever, we'd be glad to have you. But just to link somebody with resources, we'd be glad to do that.
Okay. We've been here today with Stephanie Murtaugh and Mark Rogalsky from Mercy Community Health. Thanks for joining us today on Healthy Living with Tobacco-Free Allegheny. You're invited to listen to this broadcast by visiting www.tobaccofreeallegheny.org.
This is Brittany Huffman, Program Coordinator of Tobacco Free Allegheny, reminding you that November 15th through the 21st is Allegheny Quits for Life Cessation Awareness Week. Help to quit smoking is all around, including the PA Free Quit line. Call them today at 1-800-QUIT-NOW.
My name is Roosevelt. I always thought that cigarette smoking just messed up your lungs. I never thought that at only 45 would give me a heart attack. I never thought that it would stop me from playing basketball with my kids. And I never thought that it would change my life forever. My tip is, do your heart a favor and quit now.
Heart attack risk drops as soon as you quit. For free help, call 1-800-QUIT-NOW. A message from the U.S. Department of Health and Human Services and CDC.